Ever wonder why patients with acute kidney injury often have low urine output even when their blood volume seems fine? Or why bun creatinine ratio suddenly spikes in GI bleeds? These aren't just random facts, they're clues to mastering the boards. Let's break it down. The ACP 2019 Internal Medicine Board Review isn't just another lecture series. It's 49 powerhouse presentations delivered by expert clinicians, built to cover the exact high-yield content that shows up on the USMLE, shelf exams, and specialty boards. Think of it as your shortcut through the overwhelming jungle of Harrison's up-to-date and endless lecture notes. Each session is tightly focused, clinically relevant, and laser-targeted for board prep. Let's say you're struggling with differentiating nephritic versus nephrotic syndrome. This course not only clarifies the pathology, but ties it directly to patient presentations, labs, and exam questions. And it's not just about kidneys. Cardiovascular? Covered. Infectious disease? Yep. Endocrine, GI, heme-onc, rheum, pulm, all there. These aren't boring, monotone slideshows either. You get real professors, real clinical reasoning, and mnemonics that actually stick. One of the coolest parts? Case-based learning. You're not just memorizing, you're thinking like an internist. That's what makes this series a game changer for med students, residents, and even practicing physicians brushing up their skills. So if you're tired of piecing together scattered YouTube clips and outdated review books, this is your all-in-one survival guide. You'll save time, study smarter, and gain the confidence to crush your exams. Want the full package? Click the link in the description to get the complete PDF download and video series. Trust me, it'll change how you prep forever. And hey, if this video helped even a little, hit like, share it with your study group, and don't forget to subscribe for more life-saving study tools.